Hello, and welcome to the presentation looking further into the gut microbiome, its importance and effects on mood and behaviour. So let's begin. Here's a brief summary of what we're going to cover today. We shall start by looking at the prevalence of anxious behaviours and why we may be seeing more issues post-COVID, along with the signs owners need to be looking out for that their pet may be struggling. We will then move on to learn about the gut-brain axis, and in particular, its link to the microbiome. We will cover the mechanism of action of postbiotics, tryptophan and alpha-casozepine before looking at the specifics of Serenacare. We'll finish up thinking about how we can offer behavioural support in practice and where to look if we need more help. So in 2020, a Finnish study was published looking at canine anxiety in 13,700 pet dogs. The numbers involved make for some pretty robust data, which is interesting to look at. In this population, over 70% of dogs were reported to show some sort of anxious behaviour. Of that, 32% showed noise sensitivity, 29% general fear, 14% aggression, and 5% showed signs of separation-associated anxiety. So let's talk about the knock-on effects of COVID-19 and why we think these numbers may be increasing. Well, COVID certainly has not seemed to have helped. Can you think of anything which changed during lockdowns, etc., which may have contributed to ongoing anxiety-related issues in dogs and cats? As lockdowns came, we were all stuck at home and suddenly our pets' routines were turned upside down or new puppies and kittens were acquired. They were rarely left home alone, may have had more interaction with the owners, which could be positive in some ways, but also may have interrupted their need for adequate rest, as well as allowed for them to be desensitized to being left alone. As new breeders entered the space during this time, they often failed to provide suitable guidance to new dog owners regarding needs for training and socialization. And let's not forget our cats and their socialization as well. That said, even if new owners hoped to train and socialize their pup, classes weren't running and opportunities to expose them to novel places, people and experiences were very limited or even restricted. Not only were the changes sudden on entering lockdown, but there was little guidance as to how to gradually return things to normal for our pets. Owners were returning to work, leaving their pets to deal with the new challenges of being left alone. It's also worth noting, particularly in cats, that whilst behavioural changes may not have been noticed at the time, we know chronic stress can manifest as physical disease. Are you perhaps seeing more cases of chronic pain, infections, or immune disorders in clinic? So what do we really actually mean when we talk about anxiety and stress-related behaviours? There are various signs an animal may display which demonstrate they are feeling anxious or stress. Oh, can I start that again? Sorry. Okay. So what do we actually really mean when we talk about anxiety and stress-related behaviours? There are various signs an animal may display which demonstrate they are feeling anxious or stressed. We can generally class these into mild, moderate, and severe behaviours. Typically, an animal will start by showing mild behaviours, and if their anxiety is not relieved, they may escalate to moderate and even severe behaviours. Here are some diagrams to list the difference in behaviours when the animals are experiencing stress at different severities. You can see a variety of behaviours here, from subtle signs such as lip licking and yawning, through to obvious aggressive signs such as lunging and biting. Of course, any open-mouth breathing in a cat could be a sign of a medical emergency, so should be seen by a vet ASAP. Essentially, as veterinary professionals, we want to identify signs of anxiety and stress when they are presenting in their mildest form and address them at that point, rather than allowing them to escalate to become severe, which will likely require a lot more effort to reverse. I'll also add here that, worryingly, 48% of the 745 vets questioned as part of the PDSA Animal Wellbeing Report in 2023 felt there had been an increase in the number of dogs being put to sleep for behavioural reasons. So have a think of the number of patients you see on a daily basis exhibiting these signs of stress and anxiety, what are you doing in practice or advising clients on how to currently help to improve these behaviours? So we've seen that anxious behaviours are quite common in our companion animals and have considered signs to look out for that a pet may be struggling. So now we'll look into the gut-brain axis and how what goes on within the GI tract can have knock-on effects in the brain, particularly with regards to mood regulation and stress reduction. We understand the importance that the microbiome plays in so many body systems beyond the gastrointestinal tract. Here we are going to take a more detailed look at the gut-brain axis and in particular the gut-brain microbiome axis a little later. So the gut-brain axis is a simple term to describe the bidirectional or two-way communication occurring all the time between the gastrointestinal tract and the brain. In fact, the gut is sometimes referred to as the second brain, as it contains so many nerves. The various communication channels include the nervous system, central, enteric, and autonomic, and endocrine, i.e. the hormonal. For example, hormones secreted by the brain trigger cortisol release, which can then have effects on the gut, for example, slowing motility, etc. And hormones released by the gut following ingestion of food send messages back to the brain, which result in the sensation of satiety by inhibiting leptin secretion, which is a hormone. Let me just redo that sentence. Which is a hormone. The immune system antibody. Oh, sorry. Let me just redo that. Which is a hormone. The immune system, antibodies released in the GI tract, can travel in the blood to the brain. Neuroendocrine, 90% of the body's serotonin is produced in the gut. Whilst this does not itself cross the blood-brain barrier, it can send messages to the brain via peripheral nerves and all the bloodstream. I'm just going to scratch this. Give me a second. Okay. I will start again. Okay. So, which is a hormone? The immune system. Antibodies released in the GI tract can travel in the blood to the brain. Neuroendocrine. 90% of the body's serotonin is produced in the gut. Whilst this does not itself cross the blood-brain barrier, it can send messages to the brain via peripheral nerves and all the bloodstream. And finally, the microbiome, which we will look at in more detail next. The microbiome itself produces neurotransmitters such as serotonin hormone, which you may know as the happy hormone, GABA neurotransmitter, and dopamine, which is a complex hormone and neurotransmitter used in your fight or flight response, which can both act locally on the enteric nervous system and then send messages to the brain via nerves, and other bacterial metabolites such as short-chain fatty acids, which support gut health and can therefore have knock-on effects to the functioning of the brain. Given the fact that the microbiome can essentially communicate with the brain in a multitude of ways, it is not surprising that when the microbiome is disrupted or thrown into imbalance, what is known as a dysbiosis occurs. Dysbiosis is the beginning of the process toward pathogens entering the bloodstream and infecting the animal. From dysbiosis, this then leads to the damage of the gut lining, which then reduces the integrity of the gut barrier, thus allowing the flow of foreign substances like luminal contents, bacteria and toxins through the gut wall. This imbalance, although it may sound small, can have a direct impact on brain function and behaviour. Dysbiosis can even be linked to immune system dysregulation, as well as various different neurological and psychiatric disorders in humans, as we can see here. However, it is important to say that even though dysbiosis was identified, whether it was down to cause or effect of these conditions and diseases, it is still open for further research. But it opens a focus in this topic where its significance had not been previously appreciated. So moving on to evidence for the existence of the gut-brain microbiome axis. Several studies have been published demonstrating a link between the canine microbiome and behaviour. Here are 3 examples. Certain bacterial species have been shown to be elevated in the microbiomes of aggressive dogs, and 2 separate studies have shown probiotics to reduce signs of anxiety and aggression and separation anxiety, respectively. So this further reinforces the significance of symbiosis and how it can help in the animal's overall level of response to environmental stimuli. So if we know that dysbiosis can be problematic, how can we go about trying to reinstate a symbiotic state within the gut? Well, there are several options. We can use prebiotics, probiotics, and postbiotics to support a healthy microbiome. There is also the option of a fecal microbiota transplant, where a sample of feces can be taken, and therefore all microorganisms it contains, from a healthy donor and implant it into the patient with a dysbiosis, or the animal's diet or lifestyle can be altered. For example, by adding fiber in the diet or reducing chronic stress, as we know, stress itself can result in a dysbiosis, which, as we have almost probably seen the result of in our stressed animals as soft feces or diarrhea, I'm sure you're familiar with probiotics and prebiotics, which is spoken about a lot when it comes to gut health. But have you heard of postbiotics before? Okay. And do you know what they are? We're going to look into these. We are going to look at these in more detail now. So postbiotics have recently been defined by the International Scientific Association of Probiotics and Prebiotics as a preparation of inanimate microorganisms and or their components that confers a health benefit on the host. The name comes from post, meaning after, and bios, meaning life. Essentially, they can be the whole intact, non-viable microorganisms, or even their structural components such as cell walls, cell membrane proteins, short-chain fatty acids, etc. However, whilst a postbiotic can include metabolites, they do not have to. And the metabolites such as peptides and short-chain fatty acids alone are not considered postbiotics according to the ISAP definition. So what are some benefits of using a postbiotic as opposed to the common combination of pre and probiotics? First of all, because they're inactive, there is more confidence in them when it comes to maintaining efficacy when used alongside antibiotics, for example, as well as maintaining stability during the manufacturing process. Probiotics are more straightforward. Postbiotics are more straightforward to register as they are dead microbes, and so bacterial species and strains that are currently not approved for use as live probiotics can be utilized as postbiotics, allowing the known benefits to be reaped sooner. So if you have a look at the diagram here, you can see the microbial barrier, which is here, the chemical barrier in the form of the mucus layer, the physical gut barrier, and the immune barrier. So how do postbiotics work? They can modulate both local and systemic immune responses. Constituents of the postbiotic may pass through the mucus layer and stimulate the epithelial or immune cells. They can support the barrier function of the gut, for example, bifidobacterium species, have been reported to induce signaling pathways that promote tight junction functioning. They can increase short-chain fatty acid production. And we know short-chain fatty acids themselves offer many benefits, such as acting as an energy source for the enterochromaffin gut cells, promoting the growth of beneficial bacteria and supporting the gut barrier, etc. Finally, they can also alter neurotransmitter production. So increased short-chain fatty acids can increase endogenous serotonin production by the enterochromaffin or gut cells. Here, we have just seen how closely gut and brain functions are intertwined. So it's not surprising at all that all of the above can have knock-on effects with brain function, emotional regulation, and potentially behavior of the animal. Okay, so I have just a few examples in human and mice of the studies where postbiotics have been shown to have positive effects on behavior. The first, looking at the improved mental state, sleep quality, as well as the microbiome of the healthy adults under stressful conditions, where the reduction in the bifidobacterium species, so your good bacteria, and elevation in streptococcus, which is pathogenic, had stopped. Moving on to the improvement in cognitive function, and then recognized increase in social ability and lower cortisol, along with reduction in depression and anxiety behaviors. Now let's talk about serotonin. You may be familiar with serotonin as our happy hormone. It's important in regulation of various brain functions, including mood, understanding, reward, learning, and sleep, along with physiological processes such as GI motility, gut secretions, vasoconstriction, and hemostasis. Serotonin cannot be consumed in the diet, but must be made from dietary tryptophan, with tryptophan being essential amino acid that cannot be made by the body and must be taken in from the diet. It was first isolated from milk casein hydrolysate and contributes in part to the calming, drowsy effect of milk consumption. Tryptophan consumed in the diet enters three main pathways: protein synthesis, of which under 7% is utilized, 90% in the kynurenine pathway, which is a metabolic pathway in charge of energy production, immune signaling, and homeostasis, and 3% for serotonin synthesis. Whilst it's very important for protein synthesis, the fact that 90% of dietary tryptophan enters the kynurenine pathway, with even more being redirected this way in times of chronic stress, the kynurenine pathway is fairly complex, has both excitatory and inhibitory involvement in the stress response. However, it is serotonin which we will focus mainly on today, as this is well recognized as being of great importance when it comes to regulation of emotional state. This shows just how important it is for us to work on maximizing the amount of ingested tryptophan and adjusting the animal's internal and external environment, allowing for this to be optimized. About 3% of dietary tryptophan is used to make serotonin. The majority of this 3%, 90 to 95% of that occurs in the gastrointestinal tract, and the remainder occurring in the central nervous system. So the question you may be asking is it only tryptophan that has this ability? Well, we are well aware of the calming properties of milk, especially in babies and we are well aware of the calming properties of milk, especially in babies and animal young after suckling. Tryptophan was first isolated from milk in the early 1900s and explains some of this calming effect. But research specifically investigating the calming effect of milk in babies identified a tryptic hydrolysate containing the bioactive peptide alpha-casozepine, which is derived from a protein found in cow's milk known as alpha-S1 casein. only babies have the enzymes like chymosin within their digestive tract to release this peptide, breaking the components down, and hence only babies benefit from its calming effect when they drink milk. It may be of interest that alpha-casozepine is the active ingredient in Zilkine. It is a peptide derived from alpha S1 casein in cow's milk, which has been shown to have anxiolytic properties. Its mode of action is by binding to GABA receptors in the central nervous system, similarly to benzodiazepines such as diazepam. GABA is a key inhibitory neurotransmitter, important for regulating the stress and anxiety response. GABA agonists generally have stress-relieving effects. Alpha-casozepine has been shown to reduce stress and anxiety-related behaviors, displaying anxiolytic properties, and so has therefore put itself in a prominent position when it comes to discussions on this topic. It has a comparable effect to certain pharmaceuticals like diazepam, selegiline, where you can get side effects such as vomiting, diarrhea, inappetence, or trembling, etc. Alpha-casozepine comes without the side effects. This brings us onto our new calming product, Serenacare. So Serenacare is designed to provide calming support to dogs and cats to not only help manage stress and anxiety, but provide gastrointestinal support alongside it. Serenacare is a highly palatable supplement that contains alpha-casozepine, L-tryptophan, and petbiotics, which is a unique combination of postbiotics and prebiotics, of which they use fibersol, a resistant starch, and/or prebiotic fiber. Serenacare does not have probiotics in it, as there has shown to be an even stronger response to postbiotics, particularly heat-treated postbiotics in anxiety reduction, which are present in this. We are currently unsure of the dynamics of this, but are confident using it due to the marked improvements in comparison. This also has an artificial chicken flavoring, which contains no meat proteins and is safe for use in animals with chicken allergies. We have already looked at alpha-casozepine in terms of the molecule and how it works, but now we will look at some studies demonstrating its efficacy in anxious dogs and cats. Alpha-casozepine has been shown to reduce stress and anxiety-related behaviors in dogs, cats, rodents, and people. This first study assessed the efficacy of this peptide in cats. It was a multi-center, randomized, double-blind, placebo-controlled trial with 34 anxious cats. The cats were randomized to receive either alpha-casozepine at 15 mg per kg or a placebo once daily for 8 weeks alongside behavioral modifications such as ceasing any physical reprimands, using lots of positive reinforcement, and ensuring their environment was appropriate. They were examined at 0, 4, and 8 weeks with phone follow-ups in between at 2 and 6 weeks. Here are the results. So as you can see, the cats taking alpha-casozepine scored higher throughout the study period compared to those taking the placebo, where scoring higher indicated less anxiety. Cats on alpha-casozepine showed less fearful and anxious behaviors and were more enthusiastic to interact with both familiar and unfamiliar people. So they concluded that alpha-casozepine is effective at reducing anxiety-related behaviors in cats experiencing socially stressful situations. Now let's take a look at the study in dogs here, where they compared the efficacy of alpha-casozepine to that of selegiline, which has the brand name Celgene, a well-known pharmaceutical used in dogs with anxiety. Again, it was a multi-center, randomized, double-blinded trial, this time comparative trial as opposed to a placebo-controlled with 38 anxious dogs. The dogs received either alpha-casozepine or selegiline once daily for 8 weeks, along with behavioral modification in the form of desensitization, counter conditioning, and improving communication. They were physically assessed at 0, 4, and 8 weeks, with phone checkups in between at 2 and 6 weeks. Here we're looking at the emotional disorders evaluation in dogs. I'll start again. Here we are looking at the emotional disorders evaluation in dogs score, also known as the EDED score or EDED score, where the lower the score, the less anxious the dog. As you can see, the results are very comparable in both charts. The alpha-casozepine and the selegiline groups had EDED scores that fell over the 8-week period. If the EDED score fell below 20, it was deemed successful, which was the case in both groups. Also, owners noted an increasing improvement at the 2 phone checkups at 2 weeks and 6 weeks. So you've got your 2 weeks here, your 6 weeks there. So after this, they had concluded that alpha-casozepine was comparable to selegiline for the treatment of dogs with anxiety disorders, and given its safety and efficacy, it should be considered an option alongside behavioral support. Now, let's look at L-tryptophan. Here, the findings from 2 studies assessing stress-related behaviours in multi-house cats and working dogs have been combined, as the methodology was very similar. Both were randomised, double-blinded and placebo-controlled, and looked at the use of L-tryptophan versus a placebo. 25 cats and 30 working dogs were observed over a 3.5-month period, with the first 2 weeks to settle in to the new environment, as the behaviour is expected to be different in this time, as we know. Then the following 4 weeks, they had no supplementation, but had their behaviour assessed to get an idea of baseline behaviours. They were then randomised to receive either L-tryptophan at 12.5 mg per kg or placebo once daily for 8 weeks. So they found that the animals which received L-tryptophan supplementation showed significantly less stress and anxiety-related behaviours. In cats, they saw less vocalization, less fighting, less house soiling and scratching, and more exploratory behaviours compared to those receiving the placebo. In dogs, less barking, staring, and other stereotypic behaviour was noted. So in conclusion, the L-tryptophan was found to be helpful in the management of some behavioural disorders as part of behavioural therapy. So whilst we're talking about L-tryptophan, it seems a good time to mention the existence of serotonin syndrome. So this is primarily reported in people due to excessive serotonin release, either due to an overdose of a serotonergic medication or use of multiple serotonergic products alongside one another. However, the reports in dogs and cats are very rare and generally follow an overdose and or ingestion of an owner's medication, as opposed to use of multiple serotonergic products alongside one another from veterinary products. This can then happen anywhere between 10 minutes and 4 hours post-ingestion. So it is important that vets and nurses are aware of the potential for serotonin syndrome and the symptoms that may be associated with it. This is not to scare anyone, but just to ensure that there is awareness there, and so that owners can be appropriately educated if using multiple serotonergic products alongside one another. If in doubt, a cautious approach can always be started, where lower than required doses are used with gradual increase to the recommended dosing. This is not an issue. Serenacare contains a blend of postbiotics in the form of heat-treated Lactobacillus rhamnosus and heat-treated Bifidobacterium longum. Heat-treated Bifidobacterium longum has been shown to reduce oxidative stress and supports gut barrier function. And in combination, they have been shown to help modulate anxiety and support normal behavior patterns in zebrafish. Yes, you heard correctly, zebrafish. Now, Why zebrafish of all animals? The reason that these particular little critters have been. I will start again. Now, why zebrafish of all animals? The reason that these particular little critters have been chosen is because they have similar neurological pathways where they can experience anxiety similar to mammals, and we can get fast responses in our investigations because they respond quickly to their environmental changes. In this study, the fish were placed into a new tank, either with the placebo or the postbiotic blend, and their movement within their environment was tracked over a 2-month period. The fish that were exposed to the postbiotic blend spent significantly more time in the upper exploratory area of the tank, exhibiting those behaviours. Interestingly, the results when using the postbiotic blend are comparable to those achieved when using a live probiotic. Finally, we have Fibersol, which is a resistant starch that essentially works as a prebiotic. It is not digested by the animal itself, but instead is fermented by the bacteria in the colon to produce short-chain fatty acids. Fibersol is fermented slowly, which avoids excessive gas production and means it acts as a prebiotic for a longer period of time, providing a source of short-chain fatty acids to the intestinal cells. Fibersol has been shown to increase butyrate-producing bacteria, with butyrate being a key energy source for the colonocytes. So this helps to support general gut health and to increase lactobacillus and bifidobacterium species, which we know from earlier can make serotonin themselves in the gastrointestinal tract and suppress the kynurenine pathway, leaving more tryptophan available to reach the central nervous system. So when can you use Serenacare? Serenacare is suitable for use in dogs and cats showing any sort of anxiety, whether that is general anxiety or it is related to separation, new people, stressful situations, or loud, unexpected noises such as fireworks or thunderstorms, and it can safely be used long term without any side effects. It comes in a box of 30 sachets, which can be mixed through the food on a daily basis. It has a high level of L-tryptophan, aiding in serotonin synthesis, remember, at 250 milligrams, and it is the only product with an artificial meat flavour, and a highly palatable one at that. So it can be used by patients with food allergies, whilst others use either pork or liver powder. For best effect, it is recommended to start supplementation 2 weeks prior to an expected anxious event. It is worth noting that some animals may respond sooner than this, and in others it can take up to 6 weeks for the full effects to be appreciated. In our owner trial, it was noticeable that the effects really picked up between 4 and 6 weeks, especially with regards to noise sensitivity. So to ensure your owners get the most from the product, it is important to make them aware of this and manage their expectations. Furthermore, an additional dose can safely be given 90 to 20 minutes before an expected anxious event. While Serenacare itself offers many calming properties and is safe for long-term use, in order to achieve optimal long-term improvements in the animal's behaviour and anxiety levels, it is recommended to be used alongside appropriate behavioural training. So this is quite a nice visual representation of owner responses to the use of Serenacare and their behavioural observations with their pets. From sudden noises to unfamiliar people to separation issues to restlessness. So you can see here that various behaviours reduced in frequency over the 6-week period. The lightest bars represent behaviours that are always happening, like here. And the darkest bars, them never happening, like here. We can see between 0 and 6 weeks, the light bars get smaller. and the dark grow in size quite considerably. So it is known that a number of veterinary professionals do not feel adequately trained to provide behavioral advice. Whilst many animals will require professional support from a certified behaviorist, and I will discuss how to go about finding one shortly. In the meantime, we want to be able to offer some information and support. So, once an animal starts to show severe behavioral signs of aggression, then appropriate professional advice should be sought ASAP. Whilst awaiting behavioral support, as the wait times can be quite long, it is imperative to keep everyone safe. I will focus on dogs here as owners are liable for their actions. For example, if they were to bite or attack someone. The owner needs to ensure the dog is kept on a lead when out and about, get the owner to muzzle train the dog and use a muzzle when out of the house. A veterinary clinic should never be the first experience of the dog being muzzled. Try to avoid triggers and or known stimulatory situations. In particular, ensure children are kept away and never left unattended with the dog. So other useful things for the owner to do whilst waiting for behavioural support are to keep a record of the problem behaviours in terms of what they are, when they happen, how long they last for, and if there are any obvious triggers. If possible, to video the episodes and try to avoid a negative approach such as discipline or punishments. So how can owners help their pets? Owners can go a long way to help their pets by recognizing their specific needs, undertaking training and desensitization programs, using positive reward reinforcement and having an awareness that each negative experience needs at least 18 positive ones to override it, which will hopefully help with choices regarding certain exposures to negative stimuli and how to better navigate them. They can also help by avoiding negative training methods with discipline and punishment, avoiding triggers where possible, and whilst often easier said than done, trying not to get too stressed themselves, as animals are incredibly perceptive and will often pick up on this, leading to their own stress levels becoming affected and increasing. So moving on to think of the specific needs of different dogs and cats. As people working in the veterinary industry or as pet owners ourselves, I'm sure we are all aware of the needs of dogs and cats for food, water, exercise, and sleep. But do we consider play with people, other animals, and toys, or social interaction with people and other pets to be just as important? And what about other behavioral needs such as digging, grooming, chewing, herding, hunting, scratching? All of these are just as important for an animal's emotional well-being. Different breeds will vary in terms of which of these are most important, which we will touch on next. But it is important to find ways to provide opportunities for dogs and cats to carry out these natural behaviours for the sake of their mental state, and often the owner's sanity. Rather than getting annoyed with our dog and cat for exhibiting very normal and necessary behaviours by chewing or scratching our furniture respectively, we can instead offer suitable chews and or scratching posts to redirect these actions. If owners of working breeds are not worked in the typical fashion, for example, collies working with sheep or spaniels acting as gun dogs, you may need to find other stimulatory activities to fulfill their needs. I think this will be quite useful to show owners and also a helpful visual for yourselves. We can think of our pets' needs as filling a box. If all of their requirements are met satisfactorily and the box as a whole is quote unquote full, then they are more likely to be content and healthy. However, if they are lacking in certain needs or activities, they may, quote unquote, fill the gap with inappropriate, undesirable behaviors, such as your destructive behaviors, urine spraying, excessive vocalization, etc. When we think about our pets in these ways, it becomes easier to empathize with their inappropriate behaviors, rather than considering them naughty or bad, or resigning ourselves to their behavior, to just being an inherent part of their personality. It is clear to see that one animal may have very different needs to another. Hence, generalized recommendations are not appropriate, which further reinforces the need for a holistic approach with these animals. Instead, if we can take the time to think about the specific needs of our individual pet, dependent on their breed, and how this compares to their current lifestyle, we may be able to identify where their frustrations lie and make simple changes to resolve them. These can then have a huge impact on their general demeanour and potentially even reduce the problematic behaviour, thus improving their quality of life. It is important to highlight this, and that animals should have a full vet check over. I'll start again. It is important to highlight this, and that animals should have a full vet check over prior to referral for behavioural support. Whilst medical conditions are rarely a primary cause for behavioural issues, certain conditions can exacerbate or contribute to undesirable behaviour. For example, if you have a client concerned that their chow chow is snappy when their face is touched, only to find out that they have entropion and are extremely painful, or having untreated itchy skin can have a negative effect on a pet's overall mood. So try to look at the overall picture with your patients. Once medical conditions have been excluded, then seeking professional support from a suitably trained behaviourist is likely to be the next best step. It is important to select a certified behaviourist who is listed on one of these registers to ensure that they are appropriately trained to provide up-to-date research-based advice using positive techniques. Here is a table really highlighting the benefits and how much Serenacare surpasses those commonly used products that are in clinics. You can see here that the majority of calming products have an L-tryptophan, L-theanine combination, but only 2 make use of alpha-casozepine, which is a very potent supplement backed by scientific research. Serenacare is the only product that is specific to its target, calming effects, and overall gut health. So, just to summarize its uses, we can use Serenacare to help calm the animal and get it in the best state of mind to be the most receptive to behavioral training for the best long-term results. And here is to summarize the benefits of Serenacare, providing the animal not just with supplements that focus on stress and anxiety, but with added microbiome support. So you have multiple ingredients working together to optimize the benefits to the animal. Not to mention the fact that it is very palatable with the artificial chicken flavoring. And finally, the ease that this product brings. It is convenient and has easy dosing instructions. So that brings us to the end of our session today. I hope you found this interesting and have started thinking about ways in which you can further help your patients' experiences. If you have any questions, feel free to drop me an email and I'll be sure to get back to you. Thanks for your time.